So I would say airway assessment is not common in the cosmetic dentistry space. It's something that we do in our practice, and we've all done pretty significant training on. And the reason for that is beyond making teeth look good, we look at the individual and the health and the functionality. And oftentimes, what I find and see is people who have airway issues, and we're talking, sleep apnea, obstruction, et cetera, the response that the body has to that when we're starting to lose oxygen is you actually, while you're sleeping, kind of grind your lower jaw forward. And it's your brain telling your jaw to open the airway because it needs more oxygen. The problem with that is the impact on the teeth is significant because you keep kind of going through this grinding forward motion. You're wearing the teeth down, you're chipping them, etc. And so patients will come in to see me for a cosmetic fix to that, but it's beyond that. So there's usually more going on that we have to diagnose, we have to treat as part of the process. And the reason for that is, you can make the teeth look great. You can fix that wear and the chipping. But if you don't fix the underlying issue, they're going to do to the veneers what they did to their teeth. So it has to be seen holistically. I mean, I think most people, when we talk about breathing issues at night and the manifestations of them during the day, would recognize, sleepiness, irritability as being symptoms of that, right? A lot of times, though, people kind of just get used to it. And so they get used to not having good quality sleep and they just kind of manage it and understand that they're tired and they drink caffeine and it kind of mitigates the impacts of being tired. But what we see is, one, there's going to be some health issues. We see changes in the bite morphology, even changes in facial structures. There are health implications. We see weight gain and blood pressure issues, and there's a myriad of things linked to that. So that's why I think it's so important that not just your physician, but your dentist as well is trained on these things and able to identify all the little signs that as individuals we just ignore. So if we see a patient in our practice and, again, our team is well trained to identify all the little nuances that would indicate some sleep issues and breathing issues at night, the first step is we talk about getting a sleep study, right? And so there's different places that we partner with for getting sleep studies. There's some great even at-home options now, which we love, just to get some data and see exactly what we're dealing with. There are the majority of sleep issues that can be treated in the dental environment, right? Whether it be through, some fixing bite issues and then these mandibular advancement devices, things to wear to help mitigate what's happening with the sleep issues. There are some, when we're talking more of the severe extreme cases where, we need more medical intervention and sometimes there's surgery involved and sometimes there's a CPAP involved. And so it just depends on what we get in the data. So the sleep study is always going to be our first step. So once we identify an airway issue, and ideally, if these things can be identified in the teen years, there's a lot that can be done with expansion devices or orthotics, et cetera, to help expand the airway, give more space for the tongue and for breathing. And what's fascinating is that actually has impact on facial structures, right? And so you'll start to see a more, I would say, aesthetically pleasing facial features, right? The other part to this is when we get a collapse of our bite, so our lower jaw is collapsing in, that also has an impact to the face. And so one of the things that we look at is rebuilding the bite position. And we call that a lower third facelift because it gives a little facelift look when we open the bite up and makes it so that, again, we're getting the proportions of the face more exact to what we see as our golden proportions. So a lot of times my patient will say, if we identify a sleep issue or they come to us already with a sleep issue and talk about wearing a CPAP, and it's just, CPAPs are tricky. A lot of people have a hard time with them. They're hard to travel with, et cetera. And so they ask for what other things do we have, right? What are the other tools in the tool belt? One of the most simple ones is what we call a mandibular advancement appliance. So it's an appliance that goes in the mouth, kind of like a night guard, and it's designed to bring that lower jaw forward to open the airway. And in mild to moderate cases, those work great. In the more extreme cases, there's things called like a genoglossal advancement, like just these little medical procedures or surgeries to help give the same impact that you get with a CPAP without the equipment.